From the traditional and unceded territory of the Caledonia First Nation and the heart of northern BC, welcome to the CNC Podcast. 50 years, 100,000 alumni. At CNC, we're learning together, changing lives and creating futures. Welcome to the CNC Podcast. I'm Mark Cargelotto. Laddering is a big deal at CNC. We'll have students who will start off in a program, work in it, love it, want to advance their skills, and come back. Our guest today is a perfect example of laddering. She did a night program to introduce herself to dental care and then completed the one-year dental assisting program at CNC. Worked in the community, ended up becoming a practice manager at a dental office, and has returned to us now for a 2-year dental hygiene diploma. And she's just about to complete that and is going to share with us the 2 most important things that any dental provider needs to know before they go into that. But we're going to get into that a little bit later. Savannah Ball, welcome to the CNC Podcast.
Thank you guys so much for having me today. I'm very excited for this.
And I just wanted to let you know that I did brush and floss before coming here, so I thought I'd at least get 1 or 2 points out of that.
Perfect. We're on the same page then. We've both done the same thing today.
Glad to hear. Tell me about dental assisting and dental hygiene. Can you generally describe the differences between the two?
Sure, yeah. I think it's a really common confusion amongst people, the difference between a dental assistant and a dental hygienist. A dental assistant works directly with the dentist all day. They are the dentist's second pair of hands, so that four-handed dentistry is possible. And so you work very closely with the dentist, whereas in comparison, a dental hygienist is a bit more of an independent job. You have the opportunity to build one-on-one relationships with the patient while you still work in that team setting alongside the dentist and dental assistant. You're able to provide direct care yourself to patients.
So what sparked you to go into the dental field just altogether?
Yeah, I chose the dental field because I've always had a passion for helping others and giving back in a sense. And I wanted to do something that, kind of got me into a work field right away. And I saw dental one day and I thought, I think this is for me. And I just went for it with not much research.
And what do you love about it?
I love that part of helping others and making people feel important and heard and taken care of. And I really just like to make a difference, not only in people's smiles, but just their overall day in general. I want people to say that they loved coming to the dentist.
That's great. Now, can you tell me about your career in dental assisting and then becoming a practice manager? How did that work out for you? And then what made you think that you wanted to come back to become a dental hygienist?
Of course, yeah. So I started dental assisting. I had a job the day after I graduated. I walked into an office and though I spent 10 months in the program, I walked in and still was pale and unsure of what to do. But I started that job as a dental assistant. I worked with many general dentists in Prince George. And it gave me lots of opportunities. With dental assisting, you really have an opportunity to work with specialists along the way. So I've worked with oral surgeons and endodontists, which are root canal specialists. And then I kind of had an opportunity to start doing some administrative work, which led me to a position as a practice manager. I've really enjoyed being able to work with the team and help them reach their not only daily goals, but patient goals and their success in their career. But I was missing something in that practice management role, and that was missing that connection I was making with patients when I was a full-time dental assistant. When you're in management, you kind of have a different relationship with patients. They know you as that person that maybe calls them for money, and that's about it. But I really missed having that one-on-one connection with people, and I thought I want to be able to have a bit more control in my profession and be able to work a bit more independently, and I figured it was the perfect time for me to go back and take on dental hygiene.
That's great. Now, what about working with people, though? I presume that if someone's going to a dentist, they may not be exactly comfortable with it, so how do you help them out with that?
Yeah, I think myself as someone who has some general anxieties in life and general fears as well, that I kind of resonate that people have those fears coming to the dentist. It's not people's favorite place to be by any means. I don't think anyone wakes up the day of their dental appointment saying, yay, I get to go to the dentist today.
Oh, maybe they do.
You never know. For some people, it's exciting. I'm actually going later today. But No, I really just want people to feel so comfortable when they come to the dentist and be able to say, you know what, that was a different experience or a great experience, and really feel that their concerns about maybe coming to the dentist or what they're seeking to have done is heard and taken care of.
Now let's talk about dental hygiene for a second and coming back to school for you. So that's a 2-year program then, but are you alone as one of the only dental assistants who are then trying to become a dental hygienist?
No, our program is very diverse in the people that are in it, and it's very cool to have those connections with other people in our program. We have 2 other CNC dental assisting alumni in the dental hygiene program currently. As well, we also have international dentists, people who have been dental assistants in other provinces in Canada. So it's very diverse and very exciting for all of us to be back and doing something new.
Do you have to learn things differently or even unlearn, habits or practices that you had when you were out in the field? Because you worked for a number of years before coming back to this.
Yeah, in 7 years, you definitely have your ways even of how you say things to patients and how you do things, and you get in your own routine that's very not so much systematic, but you make sure you hit all those points that you want to hit. And sometimes those are, as a professional, those are your own choices. Sometimes in an office, those are things the office wants to make sure that you relay to a patient. And then when you come back to school, they also have their own criteria that they want you to relay to patients. So you definitely have to adjust what you're used to doing a bit. But there's definitely things that always stay the same, asepsis protocols, how to care for certain scenarios and medical emergencies and things like that I don't think people realize are part of dentistry, but they are.
So in going back to hygiene, you're going to graduate soon. What are you looking forward to?
I am most looking forward to just getting back to work. Not only 2 years full-time in this program, but I did 2 years of my prerequisites part-time while managing here at CNC. And I'm just looking forward to being back at work with my work family, as well as seeing patients and starting to build those one-on-one connections that I'll get to as a dental hygienist.
What would you say makes a good dental provider, either as a dental assistant or a dental hygienist?
You have to have a lot of care and compassion, and not only care and compassion for your patient, but care and compassion for the profession. You need to be in the profession because you want to make that difference to people. And that just makes someone such a wholehearted and well-rounded dental hygienist or dental professional that you're able to have that connection with your patient.
What would you recommend to a student who would be in your place a number of years ago, thinking about either dental assisting or dental hygiene? And what would you say to them now, do you think?
It's interesting. People have asked me, why didn't you just do dental hygiene right away? Why did you go through all of this to be, back here almost 10 years later? And if I think of myself young and fresh out of high school, I don't know if dental hygiene would have been for me because I was eager to get working. I love that fast-paced environment. I loved doing something different every day. As I've matured and gotten older a bit, I'm looking kind of maybe, I guess, not to settle down, but to just be more relaxed in my day, know what's coming, and have those connections with patients. So I think, if you're someone who's considering both of them, think about, one, where you are in life. What are you looking for day to day? Are you someone who loves adventure all the time? Dental assisting is probably right up your alley. It is such an adventure every day. And dental hygiene as well. However, you maybe know the path of your day a bit better compared to dental assisting.
Now, we've saved the best, maybe, for last. There are 2 laws, I understand, that any dental provider is going to have to deal with. I think I guessed one of them, but then you told me the other one. So what are those 2 laws?
If you're in the dental profession and you work clinically, there are 2 things that you will experience in your career. The first one that you guessed being that someone is going to bite you. Usually it's kids, but sometimes it's an adult, and it does happen. And the second one being that someone is most likely to throw up on you at some point in your career just because you are working in their mouth all the time.
I'm not sure that we're probably ending this on a high note when it comes to recruitment there. I realized we needed to keep people in suspense, but it sounds like you've had a wonderful journey, and we certainly hope that going back into practice as a hygienist is rewarding, and We're grateful for your time. Thank you so much, Savannah, for being a guest on the podcast.
Thank you so much for having me today. It was great.